Okay, so I'm doing my industry forecast on the healthcare industry. And one of the most important things when you look at the healthcare industry is demographic changes and really how those are going to affect the industry in the future. There are two main groups that are going to be changing significantly. One is just the entire population of the US and the globe. It's getting older and older on average as people are living longer and longer. And this is going to become a problem and is going to make healthcare and health insurance more expensive for everybody. As the older people are, the more expensive health insurance and healthcare is for them. So if we have an older population on average in the future, it's going to make health insurance and healthcare just more expensive in general. The aging population will increase the demand for services, which will obviously help out the industry, make it more profitable overall in the future as the population grows older and older. And the second thing is going to be how the middle class is growing, and it's growing globally, and they're going to, as they grow, increase the demand for more and more varied options on what their healthcare could be. Key skills, competencies, and qualities required. So this is more at the executive level, but fundraising at hospitals so they can continue to operate, because most hospitals are in fact non-profit. Being able to control costs as they continually rise. There's a serious problem with the expensive nature of healthcare and how much it costs to be at a hospital visit. It's important that they be able, those that manage it, be able to keep those costs as low as possible. Healthcare reform is a big issue in our country right now. What's going to happen with it? So leaders need to be ready for whatever happens with healthcare reform, and need to make sure that they're meeting the requirements for it while still making a profit. They also need to be supporting innovations within the industry so that the industry can continue to improve. Technological developments, there are a lot of them. One important one is that the internet is becoming more and more popular, and people have begun to self-diagnose more and more on the internet, which can lead to things like them not going in to a doctor's office because they know what's going on, to them overreacting and going to a meeting for no reason. You're also seeing more and more online meetings for therapy or simple diagnosis. This is what's referred to as telemedicine, where it just happens over a computer screen or a phone screen. Personalized medicine is also becoming more and more of a reality. That's where you take DNA and the genetics of a person and see what they're more predisposed to, and you can kind of catch things earlier. Handheld devices so that nurses, physicians, people in the ER, they can communicate with each other and with the hospital and update in real time what's going on. All of these increases in technology are coming at a cost, though, as the consumers are being forced to pay more and more money, and as these technological advances become more of a reality, they'll end up paying more and more. And electronic health records are being instituted more and more, and they just really make it simpler to trade records between hospitals. Employment outlook, we're looking at a shortage of doctors and nurses within the next several years. Despite all of this, there's a continual rise in employment rates, 20% over the last 10 years, and from now until 2026, there'll be an 18% increase. There's been a rise in technology-based jobs, and there's also going to be an increase in outsourcing with those lower-level jobs, especially in the tech area. And then tools for learning. There's deep learning AI that can be trained to diagnose patients, and they could be more accurate than doctors, but problems arise with this as they have to make a decision about letting a computer decide whether or not somebody lives or dies based off that diagnosis. And another resource that they can use to help them out is just being well read on issues like healthcare reform, just to make sure they're up to date on the whole thing. And here are my works cited.